Everybody, welcome back to another video. Today I want to go through kind of a two-part series of just how I like to treat the jaw and what I like to do when we're actually working intraorally on patients' mouths. I think it's one thing to be working on the muscles in a static position, which a lot of times patients clench, which makes their muscles inside their mouth super rigid, but our mouths move constantly, whether we're talking like I am now in this video, or eating, or even sleeping. Sometimes our mouth is open and closing, depending on if we snore or not, or if we're a mouth breather. So I think it's important, and I've found some success with a lot of patients lately with doing some active release techniques with the muscles in the mouth, as well as working on those muscles with both an open and closed position. So the first muscle that we're going to look at here with Andrew, as he was gracious enough to be a patient here for the demonstration of this video, the first muscle we're going to go get, and it's kind of hard to see on this model, but it is on the top side of this model that we have here, is we're actually going to go in and we're going to get the lateral pterygoid. A lot of people I see, this muscle is super tight as it opens the mouth, works on protrusion, as well as works on, if we're working on the right side, it moves the jaw to the left and vice versa. A lot of these people that we see with jaw pain, the lateral pterygoid is super tight on people. So what I'm going to do is I'm going to palpate inside the mouth. I'm going to find his pterygoid, and we're going to do it on his left side just because he's right here. Once I get in there, I'm going to massage it and get it to loosen up. Once I get in there and have it hooked, I'm then going to have him open his mouth and bring his jaw forward and back, forward and back, forward and back. We're also going to do it where he brings his jaw to the right. So we're going to do the activation of that muscle itself so that it works on having a hard end stop, so that it actually prevents the muscle from doing what it's supposed to. In turn, it will then feel better once there's no pressure on it. I can do this on any sort of muscle in the body. I found success to do it with the jaw because muscles move the jaw. So working on them in a moving position, I think, is really important. So we'll get started here on Andrew. So what I have Andrew do is I'll have him open his mouth for me, and we'll get in. So we'll just follow the top side of the mouth until we can't go any farther. So I'll have Andrew close your mouth now. Is it tender in there at all?
A little bit, yeah.
Now, Andrew doesn't have any jaw pain that I know of, so some people, they'll jump right off the table. Now I have Andrew's lateral pterygoid hooked pretty good. I'm going to have him open his mouth now. As he opens, it should get a little more tender, which is okay. As he opens, you feel that muscle pop into your fingers. I try and just provide a little bit of posterior and superior pressure just to kind of pin that muscle down, and then I'll have them close again. We'll go back and forth, so we'll do 10 of them. So once we get to 10, I'll have them close again. I'll give them a little break, and then I'll have them open slightly and bring that jaw forward and back. Again, patients will say that it gets a little more tender. This one I think really is uncomfortable, but again, I think it really helps to work on this muscle with motion. So again, we'll go through 10, and then I'll have him relax, give him a little break, and then I'll have him open his jaw slightly and have him move his jaw to the left. Or excuse me, move your jaw to the right. Yeah, it's going to be hard to do when you have your finger in there basically blocking what he's supposed to do. Good. And again, we'll go through 10 reps after I lightly massage everything out. But that's a nice thing that I like to do with the lateral pterygoid. I found success with it as a TMJ specialist, working as a physical therapist. So if you haven't tried it, try it. And for patients that have jaw pain, this sometimes is a good thing to work on at home. Thanks for watching.